I mean, I think first of all, it shines a light on it. So I think that's really important to show that whereas in some cancers we're doing better, in other cancers we do worse. So therefore we need to focus on that. And the other thing is that focus should not just be in the clinical care, which is obviously really important, but it also needs to be looking at what are the reasons for that. So what are the reasons for either increased incidence, are there environmental factors, are there genetic factors, but also in relation to treatment, are there opportunities that are being missed in terms of multiple myeloma? Are there particular clinical trials that patients should be getting access to and are not? So again, we're sort of calling that out and saying, the patients with hematological malignancies need to get the best opportunities that are available, and that should be no matter where they live. Because if you look at it, obviously, if you looked at the Eastern Europe versus Western Europe data for hematological malignancies, you see in most cases there's a drop in relation to either the efficacy of treatment or the particular unfavorable prognosis in Eastern Europe. So I suppose there's two. There's one in terms of how do we make sure that the unfavorable that's shifted, but also how do we do it in the context of not no matter where you live, that you still get access to better treatment, and also that the research is done that actually identifies potential new diagnostics, new therapeutics that can be used in hematological malignancies. Yeah, no, thank you very much. So we've already started. So we're already having conversations, for example, with the European Commission in relation to where are there opportunities to start enacting some of the recommendations that we've made. We've also, one of the great things has been this has been done with the 10 different special focus networks of the European Cancer Organization. So that means we're able to reach into different both academic, clinical, industry, but also policymakers. And one of the things we've done is brought together that community in the European Cancer Organization. So essentially, we're an umbrella organization, but very much focused on policy and implementation of policy. So this gives us, if you like, the data, the ammunition that we can then use to say, this needs to be done because we're not representing, for example, the 20 million European people who are surviving beyond the cancer diagnosis. We need a European cancer survivorship plan. And so we're focusing on targeting, particular aspects of particularly some of the ones that we feel need to be done very quickly, and starting that conversation with the legislators, with the regulators, with the people who obviously provide the funding, because it is a focus on, we deliberately focus this commission on cancer research and its implementation. And so we've started already. We've had conversations already with the European Commission in relation to some of the data. Obviously, we were, where we launched it at the European Cancer Summit, there was a lot of interest, as you might imagine. I think we had something like 600 different press items by either media or printed or online. So there is a lot of interest, but we've said the tough part starts now, but we're really driving to implement, and that's implementation is our motto. I just think it's again that sort of data trumping opinion. I think very much we wanted to have something that can be used by people, and we felt the best way for it to be used by people if they could have data or an intelligence that shows what the current situation was, and then the aspiration of where we're going in relation to that. And the other thing was really important to have those 12 recommendations. And the other thing is to recognize that we have a superb opportunity here. We really have an opportunity to reimagine cancer research, but most importantly, its implementation in Europe. And I think that's the key thing, and also to widen that sort of research agenda and to be much more holistic, recognizing that there are different things that need to come together in order to deliver the best outcomes for patients. We're not saying that precision medicine isn't part of that equation. It very much is. But, for example, if you don't have good pathology, precision medicine won't work. So you need to have everything together, and then precision medicine can really drive the initiative. But if it's going in on its own, it's much more difficult to do that. So